Well, Michael, we've completed everything on your annual check for your diabetes today. We've completed the check that we need to do on your kidney function. We've talked about your cholesterol management, the effects that diabetes can have on your heart. Really, it's been a very thorough review, and I'm happy to say you passed everything with flying colors. Remember, one thing we want to talk about with our diabetics every year is depression risk, because we know now that people who are diabetics have at least a 50% chance of developing diabetes. In fact, the curious thing is that their risk for depression increases as their blood sugar goes up. Sometimes we'll actually see patients come in who we know are diabetics and they're behaving in a depressed fashion, and the first thing I ask now is, how are your blood sugars doing? So part of what I'd like to do today is have you meet with our behavioralist. This is our behavioral health consultant, Jennifer Sale. And part of what she's going to talk to you about is how to be prepared for symptoms of depression and what to do about them. She's also going to talk to you about some tips on compliance around diabetes-related issues, your diet, exercise, things like that, because we can individualize that a little for you. So while I go get her, because she can come in right now, I'm going to have you fill out 2 questionnaires for me. They'll just take you about 5 minutes. One is the patient health questionnaire, which is a depression screen. We want to make sure you're not depressed right now. The second one is what we call the mini, and it actually looks at depression, anxiety, a whole host of things. They're pretty brief to do, and when I'm back here in 4 or 5 minutes with Jennifer in tow, you'll actually have these all done, and I can review those before you talk to Jennifer. So
okay.
I'm off.
Here you are.
Thank you. Okay, Michael, let me have a look at what we've got here. Of course, you've met Jennifer Sale before. She's our behavioralist, or BHC as we call them, behavioral health consultant. And let me look at the questionnaires that you filled out first. And okay, good. Oh, you did a great job on these. Mike's been in our practice for, gosh, over 5 years now. And he's been a diabetic for 3 years. And today I finished all his annual screenings for his diabetes. And I noticed on the questionnaires we had him fill out, on both his mini and his PHQ-9, he was a little borderline positive for some depression symptoms. And I did warn him today that you might talk to him a little bit about that, as well as some compliance issues. So I will leave you guys to it, and great seeing you both.
Okay. So Michael, it looks like you've been suffering some depression symptoms.
Yeah, a little bit down.
A little bit down. This can be common with diabetes. It's a blood sugar issue. And there are some things that we can talk about in terms of helping your mood, some behavioral things, and some cognitive things that you can do to enhance your mood. We can meet a few times. I can't do a full session with you today, but I'd certainly like to touch on those things. And, very important to be looking at your diet and exercise, also to help with your blood sugar level and so on. That exercise really increases the endorphin flow to the brain and can really help with the depression. So I'd like to, to talk to you a little bit more about that too. So would you like to set up a time to meet?
Sure, sure.
Okay. All right, that would be great. We'll talk to the receptionist and get you an appointment.
Sounds good.
Okay, great.
Thank you.